There are a number of conditions that can develop around your eyes that can affect your vision, comfort, and your looks. That's when you need a specialist who is trained to perform the delicate procedures around those eyes. We're here this morning with Dr. Leslie Pfeiffer and Dr. Lauren May, who are oculoplastic surgeons with Key-Whitman Eye Center. Good to see you again. This is just so fascinating to me, what you guys can do these days. Just really interesting. Dr. Pfeiffer, could you first tell us, what is an oculoplastic or oculofacial surgeon? What do you do?
Yeah, so we're surgeons who work everywhere around the eyes. So commonly we do surgery on the eyelids, eyebrows, eye socket, and tear duct. One of my favorite things to do is to rebuild or reconstruct an eyelid after a patient has a skin cancer surgery.
Oh, wow.
So they're going to show a picture of somebody that has skin cancer on his eyelid. He had it removed, I reconstructed it, and he did great.
That is just fascinating. Like I said, it's got to be really rewarding to be able to do that kind of thing, and that's what we're looking at right there. Wow, that has to be incredibly gratifying to do that for people. Dr. May, what else do oculoplastic surgeons do?
So another thing that we often encounter involves the tear duct system. So that system can become blocked. Patients can have constant tearing, they can have infections. We could do a surgery that actually bypasses that tear duct system, creates a new one, so that patients aren't having those symptoms anymore.
That is amazing, and it sounds very delicate, obviously. Anytime when you think about surgery with the eyes, it's a little bit frightening in ways. What other issues do you handle?
Really, we do anything that has to deal with the eyelids, whether that's extra skin that's pushing down on the eyelids, whether that's a muscle that's not lifting up the eyelid enough and affecting your peripheral vision. We can do procedures in the office. We do things in the operating room to help patients with these issues.
So how does somebody know if you can help them, if they should make an appointment? And it sounds like all they really need to do is make an appointment for a consultation. Is that the best thing to do?
That's exactly right. Just give us a call. You know, the eyelid skin is the thinnest and most delicate skin in the body, so it's really important to see somebody that specializes in such a delicate area.
So what are some of the newer things that people may not be aware of? I know women, we're always looking at how our eyes look and how, how our skin looks around our eyes. What are some of the newer things that y'all do that people may not be aware of?
So we also do cosmetic procedures in the office. So we can do things like Botox injections, we can also do filler. There are also different type of facial resurfacing techniques, including lasers and things like that, that we can do to kind of rejuvenate the skin.
Okay, and the good thing about Key-Whitman, you guys have offices all over the area. Where can people find the two of you?
Yep, so I work in Rockwall, Dallas, and Frisco.
And I'm in Dallas, Arlington, and Colleyville.
Okay, it's great to see you this morning. Thank you so much for coming in. I'm always amazed at all the things you guys do these days.
Thank you very much.
To schedule an appointment with one of the oculoplastic surgeons at Key-Whitman in Dallas, Arlington, Frisco, Rockwall, or Colleyville, here's the number to call, 214-220-3937. Or for an appointment, you can visit keywhitman.com. Stay with us. We'll be right back.